My immune system is not as good as it should be. So when I get a cold, it is more severe than most people. You know, you have to take risks in life.
I was diagnosed in May 2008. I was just in unbearable pain all the time, and I would tell my parents all the time, there's something wrong, I think I have arthritis. And they would basically tell me I was lying to them.
It's not you. It's something you live with, but it's not the entire definition of your life or yourself.
For Creaky Joints, I'm Seth Ginsberg. Here with another video. Today, we are measuring the journey to successfully living with rheumatoid arthritis. With any chronic disease, defining success is sometimes a challenge. Today we're going to talk with experts and we're going to meet patients and we're going to learn all about what it means to define successfully living with rheumatoid arthritis.
First visit, they may not even know what they have. So I think there's a huge learning curve in what the nature of disease is, what the options are.
When I really feel like someone has rheumatoid arthritis by the lab tests, the history, the physical imaging, methotrexate is really the first thing we do use as a standard of care. There are many other options and other medications that can help quite significantly, but the track record for many decades now has shown that it's an important first step for the majority of patients. It is sometimes less toxic in some circumstances, and also some medications work better with methotrexate on board as well, a combination approach. So it's easier to sometimes add one of the biologics onto methotrexate than the opposite way.
What we've devised over the last decade or so are a lot of instruments that we use to actually reproducibly measure success, and those are things like the HAQ, the Health Assessment Questionnaire, and they're very helpful both in terms of more accurately assessing whether the patient's responding well. They include things like subjective improvement, joint counts, functionality, so you'll look at various things that patients try to do or are able to do during the course of the day.
We do check some of their lab tests, inflammatory markers. Now we're starting to use ultrasound and some other imaging modalities to see do they still have some ongoing inflammation, which is an easy thing to do at the bedside, which we do here. As x-rays don't show that change quickly, we need to resort to other imaging modalities. So those are some of the first steps in determining how they're doing better or not.
The other more subjective way we measure success is looking at what the patient, what their goals are.
For the first month, it was great. A lot of the swelling went down, and I was able to walk a little bit better. My hips weren't as swollen, but right after that, it was a complete backfire. Everything got swollen. I couldn't walk, I couldn't run. And for me, being a runner, that's really important. I would have been happy to take anything if I didn't feel that excruciating pain.
My immune system is not as good as it should be because of methotrexate and because of infusion. So when I get a cold, it is more severe than most people. And my voice is not, I have a cold in my voice, I can still hear, so I cannot sing. I was supposed to give a concert this month, and it has to be postponed until September. That's okay.
I haven't run in over a year, which for a runner is a pretty big, it's huge. I swim to get some sort of exercise, which actually helps alleviate the tension in my joints.
The yoga saved me because I still stretch. I believe in stretching around, you have to continue stretching, otherwise you get worse. I teach 3 classes a week and I take 3 myself, and I believe in being active.
I think I want my life to start again because I haven't really had a life in over a year because I just haven't been able to do much. Getting out of bed, walking in the morning is one of the most challenging things I've ever had to do.
You know, you have to take risks in life, and I must say I'd rather die younger and live a life that I enjoy and do things that I like to do. And I bicycle, I swim, I do a lot of yoga, I teach, we hike. I mean, we have a wonderful life.
I encourage my patients not to be satisfied with a physician or a treatment that's just about how can we make you feel a little bit better, but what do you want your life to be like? How can we move towards you living the life that you're really meant to live? And so a physician that understands that bigger picture and helps a patient move towards it physically, emotionally, spiritually, mentally, the whole, sees the whole person. Explain to their doctor, I need to do this, I want to do this. And so that gives them the drive and shows the doctor what the markers are. It's different for every person what's going to make that difference.
If we have a patient who's had long-standing arthritis and has already sustained joint damage at the point that we put them on a treatment protocol, our goals are going to be more restricted than the patient who walks in early in the course of their disease when all they have is the inflammation and they haven't really damaged their joints. So if you take the ideal patient to treat, it's someone who has had disease for under 6 months, has no joint damage. They may be very, very poorly functional at the time because of pain and stiffness, but in that patient, our goal for a treatment response is we're very greedy with that patient. We expect a real remission in that case. If you take a patient, and again, it's not an age thing, but it's a duration of disease problem. If they've had disease untreated for a couple of years and have already lost function, lost cartilage, then our expectations are much lower, whether we start with methotrexate or go straight to a TNF inhibitor.
It really depends on how active the patient is. Some patients come in with some morning stiffness and a couple of joints that are active but positive serologies, and so we think that they're going to be a true rheumatoid. But some patients come in where they really have trouble getting off the table or out of bed in the morning, and we know we're going to have to be more aggressive in those cases, and we can't wait 3 months for them to get the full effect of methotrexate, which does take longer to kick in than some of the biologics or other treatments do. A different paradigm than it was 5 years ago even. I think we're pushing the biologics a lot more as we're able. So sometimes we need to use some steroids short term if they're not ready to use a biologic. We have other things to add to methotrexate in the first number of months.
I think sometimes people think that success is simply symptom reduction, and that's really what the aim is, or that's the marker. But one of the things that I think happens once the symptoms go away, the pain, the stiffness, the fatigue, then there's that kind of openness to life again. So I think that success has to do with moving beyond symptom reduction to how do I live a larger and more meaningful life. One of the things we've seen with people with chronic illness is that there's a similarity. It's not exactly the same. There's a similarity to something called post-traumatic stress syndrome that you've probably heard about. And once the symptoms are reduced, then they are able to have what some researchers are now calling post-traumatic success, which is coming beyond that sense of I can't, my life is limited, it's a downward spiral, to I can, and what could my life be about now? It may not be exactly the same as it was before I got the disease, but there are possibilities, there's openness, there's potential for me that there wasn't before. And I think success is when you can live into that potential of a larger life.
At Creaky Joints, we have lots of information all about the treatment landscape. Drugs are being developed, it seems like, every day, and they're very complicated. And sometimes we don't understand how these mechanisms work to make us feel better. However, when we put all these things together in combination with the bigger picture, and we understand how we're going to live our lives to the fullest, that's when we begin to live successfully with rheumatoid arthritis. Take what you've learned today and share it with others, especially your doctor. have a conversation about what it means to live successfully with RA. If we don't measure it, keep track of it, and see how far we've come and how far we have to go, then we'll miss a great opportunity to feel good about ourselves.
The outlook is great. This is not the same disease as it was 10, 15, 20 years ago. And I think we'll continue to have a brighter outlook even as the years come by.